I'm John Schrott, and this is On the Spot. Today we're going to be talking with Roger Hartung. Roger is one of my partners, but he is our in-house expert as it relates to behavioral health. It's one of his passions in life, and he has seen behavioral health and how the physical environment is constructed to support appropriate care transform over the years. And maybe, Roger, you can just maybe share a few things about behavioral health.
So, it's interesting you talked about over the years, because when I first moved to the South Hills of Pittsburgh, Mayview Hospital was still open. And it's where we put our family members who we didn't know what to do with, because we were sort of at our wits' end. And there were, behavioral health care, was trying a lot of things with the variety of degrees of success, and with, pharmacology, we've made some great strides. In fact, we've been able to treat a lot more people outpatient, as opposed to inpatient, and we don't know what to do. The other thing is we're really sort of changing our view about this. There's a lot of people that think, what is up with that person? They are not being personally responsible. They're throwing opportunities away. They're throwing their life away. Why are they doing that? How did they end up in jail? How did they end up homeless? And a lot of times, it's untreated behavioral health conditions or self-treated behavioral health conditions, as the case may be.
So you mentioned Mayview, and I also live in that part of the region. And I remember, it was really pretty much a concrete box with
Yes.
Little punched openings and all of that. And, how has the physical environment changed to be better for those types of patients?
Well, it's interesting. So security is still really important, but, we want to have the perception of not having any security. So, we don't want something that looks like a jail or that looks like it's hard to get through. We still want to have beautiful materials that are durable, unpickable, can't be weaponized, but are still, maybe they're spa-like or they're residential like. It's very stressful sometimes to, especially if you're being admitted as an inpatient, to come into this environment, or if you're the loved one of someone and you're bringing that person to become an inpatient, and you go, oh my goodness, I'm taking somebody someplace to stay a little while that is not their home. And I think they're going to be safer in some place that is not their home. We don't think home is like the safest place to be. And so that's incredibly stressful. So it's important that we have, views of the outer doors, access to the outer doors, pretty colors to look at, pictures,
So you utilize the outdoor space as well as the indoor space.
So absolutely. Well, it's interesting. I keep thinking the FGI guidelines should require outdoor spaces for behavioral health inpatient, but they don't. It's always a good idea. You almost always have them, but it's such an important part of healing.
And can you mix inpatient and outpatients in the same facility?
No, well, in the same building, I guess, technically. But, you've got to have completely separated circulation. You're most likely going to have separate entrances and exits in order to be able to manage that. It's interesting. You also have to separate, child and adult, and we've looked at some facilities where you've got child, adult, inpatient, outpatient, and you've got a variety of aspects that you've got to, patient types that you've got to keep separate.
It is interesting that we as a nation are finally starting to realize the importance of caring for people that have behavioral health issues. So I appreciate your knowledge in that and how you advance our organization to really impact those patients. So until next time, this is On the Spot.